Last year, and maybe years before, one of our guests has been Jule and Lieberman. And she, I believe, is here again to come up to the podium and talk about using tools and techniques to expand your world. You suffer from some of the things we've talked about, or a family member. These are things that you need to know about. Okay, yeah, and I'm right up here at the podium. You can hear me? Okay, there you go. Okay.
And I've got a volunteer to push the slides for me.
Okay,
How do I do
very
that?
good.
Do I just,
Wait a minute, first I'm going to tell her how to push the slides.
to just go across that?
You've been in a...
No, do you want to know how to push the slides?
Oh, I didn't.
Oh, is there an hour?
I think I probably just,
You just did it?
I don't know.
Oh, yes, so it's not working. We'll try it together.
Maybe I just press this button.
Thank you, everybody, for your patience. I have a volunteer with me today, one of the Delta Gamma volunteers, and she's going to be moving the slides along for me because I cannot see either what's behind me or what's in front of me. A little bit about what Easy to See Foundation does and what I do. I'm currently finishing my master's in low vision rehabilitation therapy. And like Dr. Edmonds just described, there is a point where your glaucoma may start to interfere with your daily functioning. And what low vision rehabilitation therapy does, it takes whatever you've got left of your functional vision and we maximize its use so you can continue to see something and function with that visually as long as you possibly can. Most of the people that I work with are typically legally blind or have enough of a field restriction that is starting to interfere with daily functions. Okay, do you want to hit the next slide? Some of the common causes that you have for glaucoma happens is that you start losing that perimeter field. You'll notice things like you start bumping into furniture, you'll start missing doorways, and little bit parts of your world becomes, I like to say, shrinking. When I worked at an agency for the blind not so long ago, I had one of my favorite students. I was a computer teacher, and one of my favorite students, she could not walk into a room and find the chair without using adaptive techniques. However, she could sit down and pick up a paperback book and read a novel. So for us, for me, I said, you're like the opposite of me. I have no central vision, so I could get in the room, find the chair with some good scanning, but I couldn't read the book. So each one of us were legally blind, however, very different in our visual functioning. So what my job is, and what I do with people, is to identify what areas of vision they have remaining, and so we can maximize it. I like personally to work most directly with people that have gone through a low vision clinic, like here at Wills, and work with them so I have an idea that they've had their best correction already taken care of. You just heard from Dr. Edmonds how important it is to have that refractive error corrected. So we want to make sure we get whatever's left of your vision functioning as best it can with whatever optical means possible, and then we add in all the other little extra tools and techniques so that you too can continue on. Next slide. Okay, which one's this one? Okay, common tools. Common tools that I usually see people that are using with glaucoma are tools that are meant to expand the view. What happens with a restricted field is that part of your focal distance becomes narrower and narrower, or parts of the vision just disappears. So what we try to do with some of the common tools is to expand that view. Next. And the first one that we typically talk about is a reverse telescope. Now, a reverse telescope is not a very fancy device. All it is a telescope that you would be using to look at a distance, kind of like binoculars. In most cases, it's just one lens, though. It's usually one of the scopes. And instead of, when you typically look at to bring things closer to you, it makes it bigger, but you lose part of the field. So what we do with a reverse telescope, just by, as you can gather by the name of it, we turn the lens around. So instead of having the lens that typically would point out to see something at a distance, we turn that lens toward our eye, and then the ocular end, which is the eye that you would normally put up to your eye, is facing out. And what that does, the way the lenses are put in for a telescope to work, when you reverse it, it actually takes that view and shrinks it a little bit. So we're shrinking that larger image, which you're not getting all of it because you have a field loss. We're shrinking it down and taking advantage of whatever's left in the central part of your vision. We were talking about earlier today, too, about the different parts of the retina and how certain parts of the retina deal more closely with your detailed vision, for your reading and your near task, and then the other parts of your retina that go on for more your peripheral and your mobility issues. So what the reverse telescope is doing is it's basically shrinking something down enough so you can get a quick, I always call it the eagle's eye view, so you can get an overall view. We don't want you walking around with a telescope in front of your eyes because it's going to cause a displacement effect. However, for a quick spotting, what's great about the people that use these is they can walk into a room such as this, and they'd be able to tell by scanning with the telescope where the empty seats were in that row. So then they can proceed to go and find their seat there. Next slide. Mirrors. Mirrors are my favorite example because they're something that everyone is using and we don't know we are using them. Most commonly, you'll see how it affects expanding the view is whenever you've gone to, I often see them in drugstores, but you'll also see them in smaller grocery stores. It's up in the corner, usually up near the ceiling. There's a mirror that's kind of curved. And what that's doing is it is giving a view of the whole room in a concentrated area so that someone like the manager or the security people can keep an eye on the whole store at one time. And there are people that are using these mirrors effectively if they're in the workplace so they can get a better big view of what's going on so that it can fit into that narrowed area of their view. The last one I'm going to talk about is minifiers. Minifiers, obviously, by virtue of its sounds of its name, is the opposite of a magnifier. So instead of enlarging something so it's pushing it out of your view, a minifier is an artist's tool that people have been painting for years, have been using, where they want to get a good image of a still life, for example, but they want to get the perspective right. They use it a lot for perspective. So they'll use a minifier and look at something. Where I found that clients that have used minifiers, what they find useful is that they go into their office, for example, or in their kitchen, and the countertop's full of different things. But in order for them to find the can opener, okay, they really have to do a lot of scanning. But what they can do with the minifier is they look through the minifier and then they say, oh, that's where it is. It's next to the toaster. So that they get a gross idea of where it is in that placement on that counter, so then they can retrieve it more effectively. In addition to these tools, I want you to keep in mind, too, that you need to employ some other good effective strategies and techniques. All of these techniques will be covered in greater detail with an orientation and mobility specialist. As a low vision rehabilitation therapist, I can introduce you to this, decide with you in consultation whether some of these techniques would be helpful for you, but I don't necessarily am not certified to do the orientation and mobility training. But some of the techniques I can go over with you is some effective scanning. So what you're going to be doing is you're going to be moving your heads and your eyes around so that you can take advantage systematically of what your view is. I'm going to have you tell me which one's first. Okay, the lawnmower technique. The lawnmower technique is pretty much what you can imagine what it is. When you ever watch somebody cut, big plots of grass, what they end up doing is they go up one way, and then they turn around and they come back down again, and they go back and forth across the view so that they can effectively cover parts of an area at a time. Typically, if you're looking at in a room, you'll start at the top, move across, move down, and then keep continuing going back and forth that way.
Parameter scanning.
Perimeter scanning technique is kind of like looking through, I always refer to it as the picture frame. You start, say, up at the left-hand corner, you move across to the right corner, down the side, and then back over and up again. So it's almost like you make smaller and smaller picture frames as you scan the room. So if you're looking at something in an environment and you start making just like squares, getting squares smaller and smaller down to the center till you locate what you're looking for. Diagonal lines technique, I like to refer to this as making the X. You start at the top left corner, for example, scan across the view down to the right-hand corner, go reverse back over to the left-hand corner, and go back up again like a big X. And then you can actually narrow in on your target by using the diagonal technique. Concentric circles. This is one I demonstrated last year, so if I repeat for those of you, and maybe for the people at cyberspace, it's new for them. Concentric circles are a really good method, especially if you drop something. You start out with fixating in one center spot, and then moving, your vision out, and also tactily moving out in a circle till you locate greater and greater areas. Okay, alternate scanning pattern is if you were looking at, like you were reading a book. So in other words, you start at the top left corner, you go across to the right, you diagonally shift over and then lower down to the next line and then read across. So these are all just different types of way you can move your eyes and your head around so that you can fill in the missing parts of your view, take advantage of whatever's left of your central vision, and move it around so that you can actually put together in your head the full full area that's visible. Okay, traveling skills. Glaucoma individuals typically, when they start having some functional difficulties, it's with the mobility. I mentioned earlier about bumping into things. Locating where where the relationships of where things are. So one of the first tips we do is called tracing. And tracing is an ability for you to fixate on one particular line and then follow that line down with your eyes until you can locate different objects. A good example of that is if you're in a building such as this. To find the doorway for the doctor's office, I would first locate the wall, travel down, depending on where your field restriction is, travel down the line, and then see where the next vertical line goes up. That's chances are is a doorway. In hotels, for example, when I stay at a hotel by myself, I have a tendency to do the tracking, but then I also count. So in other words, my room may be 5 doors down from the elevator. So that's a way to effectively using tracing. Tracking is the opposite, where tracking is not really the opposite. You fixate on a moving object. So in the case of when you're traveling down the street, for example, you could be looking at a straight ahead and you locate something to fixate that's moving in the same direction you are. Or in the case of crossing the street, you're tracking how many cars are going across in front of you. I use tracking an awful lot when I'm leaving the train, for example. I have to say, I pick something out that's pretty visible for me to see, like a person with a bright red backpack or something like that, and I track that backpack as it's walking along the platform. And tracking also means when I'm going up to the stairs, I can tell, holding that image in my view, I can see when they're going up the stairs. So I see when the person's getting higher in my view, I know that they've reached the stairs. So all that kind of information is useful for mobility, especially if you have a restricted field. All these techniques that I talked about today are all done in concert with any kind of rehabilitation program, and in particular with orientation and mobility for persons with restricted field. All these factors come into play. None of them are going to be used all the time, but in some circumstances, for example, the different scanning techniques apply more effectively. So if you're doing, if you drop something, maybe the concentric circles are a little bit more effective, but if you're entering a room and you need to find a seat, it may be more effective for you to either do the, the lawnmower or the alternative scanning, so that you have some ways of systematically viewing your environment within that smaller view. And I have references on based on this material, and I tried to leave a little bit extra room. The common question people ask me, which is not on the slide here, is when is it time for me to think about, and that question sort of came up with the low vision clinic question, when is it time to seek assistance for some of these concerns? Well, again, in consultation with all your eye care professionals, including your specialists in glaucoma, your regular ocular health exams, with a low vision clinic, there'll become a time where you start determining between all those professionals that there's a functional loss here, and maybe rehabilitation is part of the next plan. When do you start using a white cane? Well, that's very individual for every person. It depends on if you're never moving around in unfamiliar environments, maybe never. But if you continue to stay independent and go outside and travel through the world, you very well may need this for two reasons. First off, the reason for your safety, so that when you take your next step, you want to make sure that there is terra firma beneath that foot, that there's something not in your way, that you're not going to bump on the side. So that's a good clue. That's when you're going to need it. The second reason is that, and this was pointed out to me personally, I guess 14 years ago, the person said to me, do the people know you can't see the cars coming, right? And I said, that's correct. He said, well, how does the driver know that you can't see? The white cane has also served as an identification tool, that this person has a vision impairment. So carrying a white cane doesn't mean you're totally blind. It means you have a vision impairment. So there comes a times where you make a decision whether that mobility device is effective. Now, I also use a different mobility device. He's got 4 paws. He snores. By the way, I had to wake him up back there. He was snoring. No offense, doctors ahead of me. So when did I make the choice whether I was going to use the dog over a cane came about when I realized that I walk as fast as I talk, and my coordination wasn't there. I was not keeping up with, my cane wasn't keeping up with me. So I found it more effective for me to use my guide dog. Now, I have since worked on my white cane skills a whole lot better. So you really should have both in your toolkit. If you're going to use a guide dog, you better be able to use a white cane as well. So they're the common things, and that's a real personal decision on when it's time to seek these mobility devices in consultation with professionals about your functional vision. So determine what you've got left of your remaining functional vision, and then we can apply the techniques and tools that work best for you. I happen to have a very lovely tool right next to me. He's very cute. But again, that decision is something that has to take with a lot of consideration. Anybody have any questions offhand? And I'm going to ask my friend here to let me know. No? Yes? No? Okay.
Well, we thank you.
Thank you very much.
Thank you.